these numbers are not changing. And so it really, it takes a community. We all have to be educated. We all have to realize that, again, this disease does not discriminate.
Welcome back to On the Go with AC. Our guest today is Dr. Fayron Epps, founder of Alter and professor of UT Health San Antonio. Dr. Epps, thank you so much for joining us. How are you doing today?
I am doing good. Thank you for having me, Anthony.
Not a problem. So first, tell us a little bit about yourself, your background in the medical field to where you are today.
Yeah, sure. So as you mentioned, I am a professor at UT Health San Antonio, also the endowed chair of caregiving research. I am also adjunct associate professor at Emory University in Atlanta and the founder of the Alter program, where we partner with predominantly Black churches across the country to equip them with the resources that they need so they can become dementia friendly. So I've been a nurse for over 20 years. I cannot believe it, but it's been over 20 years that I've been a nurse, and things are going great. I started working in the dementia field, caregiving field for the past 10 years, doing research in this area when I realized how the Black community was disproportionately impacted by Alzheimer's disease and other forms of dementia. And so that's when I just created it, said that, well, I said that this is my mission, that now is going to do more awareness and come up with programs and supportive services that can help families that are on this journey.
So for people who may not know about dementia, could you tell us a little bit about what it is? What are some of the early signs and who it mostly affects?
Yeah, so dementia, a lot of people get dementia and Alzheimer's disease confused. And dementia is the big umbrella term that speaks to the impairment in cognitive and behavioral abilities. So it's just not memory loss, it's also behavioral abilities that interferes with your everyday life. So this is when something is occurring that you cannot continue to function every day. So this is different than us forgetting where we placed our keys, but 30 minutes later, we can retrace our steps. Someone that is showing true signs and symptoms of dementia will never remember where they placed their keys. They cannot retrace their steps. And that's an example of interfering with their everyday life, because now they cannot move on and drive or go here and there. So I just wanted to kind of break that down. What does interfering with your everyday life is like? There are several different types of dementia. When you Google, you'll see literature says more than 70 types, more than 100. There's more than 300 types of dementia. I just tell people it's a lot of types out there. There's so many different causes that can lead to these dementia symptoms. One of the things you hear a lot about is Alzheimer's disease, which is the most common form of dementia. This is where they're saying that you have more than 6.5 million people in the US that are affected with this. And the Alzheimer's Association Facts and Figures that comes out every March is a good resource for your listeners to go to and read on what are the statistics, especially within their state. What is that prevalence rate that is there? Dementia does not discriminate. I want to be very clear. When I was growing up, I thought it was only for white people, Anthony. And so I thought it did discriminate, like only white people get dementia. We don't get that. But as I got older and starting to work in the nursing field, and then also doing my research, I seen that it truly does not discriminate. And in fact, our African American communities, our Latinx communities are disproportionately impacted by dementia when we compare them to our white counterparts. And the dementia we get tends to be vascular dementia. And that is something that we just need to be really mindful of. And you may say, well, what's the vascular dementia? That is when you have a disruption in your cardiovascular system. It puts you at risk for vascular dementia. So that's your strokes, your TIAs, diabetes, chronic kidney disease, atrial fib, all these conditions that tend to be more prevalent in our community. And when we don't take care of it, it puts us at risk. There's also Lewy body dementia, Parkinson's dementia, frontal temporal dementia. I can go on, but the ones I've just named are some of the common ones that you may see.
Is there a call to action? Because the Alzheimer's Association, they published a study titled "African Americans in Alzheimer's Disease: The Silent Epidemic." Are there, since they published that, we know there's been treatment as well that came out, I believe, in 2023. Are there any types of call to action to address the issue? Do you feel like more work needs to be done? Where do you think that stands on that?
Yeah, I think there is a call to action. This call to action has been a call for some while, for some time, for us to address this. And one of the things that really, it kind of upsets me that for the past 10 years this has been the call to action, and we still cannot get anywhere. We're still not doing anything. No, these numbers are not changing. And so it really, it takes a community. We all have to be educated. We all have to realize that, again, this disease does not discriminate, not just with race, but also with age, and gender. And so this can impact any of us at any time in our life. And we have to come together. I particularly work with Black faith communities, building capacity within them so that they can serve the communities, because many times in our Black and Brown communities, the resources are not there. Healthcare is not easily accessible. So I want to make sure that our faith communities, places of worship, have what they need so they can serve these families. So I do a lot of that. I do a lot of, again, promoting education, dementia awareness, brain health. I do want to mention the 6 pillars of brain health, because right now you may be like, well, I don't know no one with dementia. I don't have it, so I'm not going to listen. But I want you to listen, because there's some things you can do to maintain your brain health. So hopefully it can reduce your risk of dementia as you get older. The first one is social engagement. It's so important for us to engage, talk on the phone, get out, go to activities. That social engagement is really big. The next one is brain stimulation, and so that is learning new things. So you want to stimulate your brain, and you want to do challenging activities. So not just, oh, I'm just going to read a book. No, you want to do something that's going to really challenge you. So a hard puzzle, learning a language, learning how to play an instrument. The third pillar is meditation, right? Reducing your stress. What are those things that you can do to reduce your stress? And I know that looks different for everyone. And I said meditation, but that might not work for you. But whatever it is to reduce your stress, I know it's easily said than done, but we really need to be careful, because stress really, and we've been seeing this in literature, it impacts our health, our physical health, big time, and it can put you at risk for dementia. Racial discrimination falls under stress. And these are the things that many times we're faced with just because of the color of your skin. And so we need to be mindful of that. And that is one of the reasons that maybe we are put at a higher risk as well for dementia. The fourth pillar would be sleep. It is important to sleep 7 to 8 hours a night consistently. I think that's also easily said than done, but do your best to sleep. This is when you're recharging your brain, you're flushing out those plaques and those tangles that's being formed that put you at risk for Alzheimer's disease. So sleep is important. Exercise is the next thing. You want to exercise where your heart rate goes up, you start to perspire. This is the type of exercise that you want to have done or be participating in. And you want to make sure, if you're under the care of a provider, that you do check to make sure that it is okay, you have their clearance. And then the last one is eating right. I don't recommend any special diet, because I feel that we all know what we should be eating, but it's so important that we eat right. And this can also reduce your risk of dementia.
Are there any common misconceptions about this dementia?
Yeah, I think I kind of hit on that a little bit earlier, where I spoke how dementia does not discriminate, and it's particular when we relate to age. A lot of people just think it's a old folks' disease, Anthony, and that's not the case. I've met individuals that started showing signs and symptoms in their mid 30s. So this is not just old folks, and that is one of the biggest misconceptions. Also, another one is the signs and symptoms of dementia. People just think it's part of normal aging, and that is not either. So, when you recognize these signs and symptoms of dementia, you want to make sure that you do seek help, especially in the Black community. We tend to receive our diagnosis later, which that puts us at risk for having certain supportive services in place. And so, it's so important for early detection, early diagnosis.
Now, thinking about, let's say, a generic family, they have a loved one that's been diagnosed with dementia or Alzheimer's. How can the family support that loved one? What are the resources they need to do? What do they need to do in case they run into that situation?
Yeah, I think, Anthony, one of the things is to ask, is this person, if they if they're showing signs and symptoms, are they acknowledging it, or they're in denial so that it looks different, right? And so if you have an individual that acknowledges they're experiencing signs and symptoms of dementia, then you can support them and start putting things in place. So, meeting with a attorney that focuses on elder law is very important. So you can put your financial matters. You can have some things put in place for that. Also, if you need to do a trust, thinking ahead when you may need more care and support is really important. I always tell families it's important to have a conversation, bring everyone together so we can discuss what this will look like. For right now, there is not a cure for this. And so it is a progressive disease, and it varies on how fast it progresses. It can be from 3 to 20 years. Everybody's different. When you've met one person with dementia, you've only met one person, and you cannot compare. You can't say, my Aunt Susie was like this, or my Uncle Joe would be like that. So that's why it's so important to have conversations at the beginning when you start noticing signs and symptoms, or you just received a diagnosis. To have these conversations and see what can we put in place, make an appointment with an attorney, go to the bank, just start planning ahead of what things need to be done. Now, most of the time, so that's good. That's the a good scenario. But most of the time, there's denial. There's denial with the individual living with dementia, or there's denial within the family. And that's what we see. And that is the conflict. Because while you're going through denial, you're missing out on supportive services. You're missing out on these opportunities to put things in place before it progresses. And so, with that, when there is denial, it just takes time. And it is that one person that recognizes it. It's just making sure that you continue to present the facts and sharing education and doing what you can to your best abilities to put things in place that can support that person living with dementia.
And I know you touched on this a little bit earlier about your altar organization. Can you tell us a little bit more about that, your inspiration? And also, you have a summit coming up in April. Can you tell us a little bit more about that as well?
Oh, yes, Anthony, you did your homework. How wonderful.
Absolutely.
Yes, no, but thank you for this. For anybody that's listening, like I mentioned, that faith communities, they're the cornerstone. They were the cornerstone back in the early 1900s. To me, they're still the cornerstone, even though the demographics may look different, the number of attendees at weekly service may look different. They're still the cornerstone of our community. And so I work with our faith communities to make sure that they have the resources that they need, make sure that they're educated. Many pastors, when I was out in the community, they didn't know what dementia is, just like, people in the community didn't know. Our faith leaders didn't know neither. So how can they truly spiritually support their parishioners if they don't fully understand some of the things that they may be going through? And so the program that I have is where we actually partner with them and give them those resources to make sure that they feel comfortable, they're confident, And they're empowered to be able to go out and not only support their parishioners, but also support the community at large. To me, it takes a village. We all have to come together as a community so we can see a dent in these numbers, and hopefully one day we won't be disproportionately impacted. And for that, I am doing a summit. I'm hosting a summit in April at House of Hope Atlanta with Pastor Dewey Smith, where we're actually bringing in faith leaders from across the country, not just faith leaders, but also caregivers, those living with dementia, anyone with ministry in their heart, so they can come and learn more about things that they can do, they can take back to their community to support these families, but also reduce their risk of dementia. So it's going to be a great time. It's going to be epic. And so please, if anybody's interested, please do reach out, or you can visit us at alterdementia.com. And that's alter, ALTER, dementia.com. And you can receive more information, but the dates are April the 25th through the 27th. We're going to do a gospel explosion. As I always like to open things up with praise and worship. I am a woman of faith, and make sure we set the tone. So for the next day and a half, we can really learn and be open to receiving the information and learning about what we can do when we return back home so we can support these families.
Awesome. Dr. Epps, thank you so much for joining us.
Thank you.